ਵੈਲਕਮ ਟੂ ਮਾਈ YouTube ਚੈਨਲ ਗਾਇਸ। ਸੋ ਇਹ ਵੀਡੀਓ ਹੈ ਪ੍ਰੈਕਟਿਸ ਕੁਐਸਚਨਸ ਦੀ। ਨੈਕਸਟ ਤੁਹਾਨੂੰ 20 ਕੁਐਸਚਨ ਜਿਹੜੇ ਆ ਉਹ ਦਿੱਤੇ ਜਾਣਗੇ ਐਂਡ ਤੁਸੀਂ ਉਹਨਾਂ ਕੁਐਸਚਨਸ ਦੇ ਆਨਸਰ ਦੇਣੇ ਆ ਬਿਨਾਂ ਕਿਸੇ ਚੀਟਿੰਗ ਤੋਂ ਐਂਡ ਇਮਾਨਦਾਰੀ ਦੇ ਨਾਲ। ਸੋ ਮੈਂ ਤੇ ਮੇਰਾ ਫਰੈਂਡ ਆਪਾਂ ਦੋਵਾਂ ਨੇ ਕੁਐਸਚਨਸ ਲਿਖੇ ਆ ਫॉर ਪ੍ਰੈਕਟਿਸ ਫॉर ਯੂ ਗਾਇਸ ਕਿ NCLEX ਸਟਾਈਲ ਕੁਐਸਚਨਸ ਆ, ਮਿਕਸਡ ਕੁਐਸਚਨਸ ਆ, ਲਾਈਕ ਸਮ ਆਫ ਦ ਕੁਐਸਚਨ ਇਜ਼ ਰਿਲੇਟਡ ਟੂ ਪ੍ਰਾਇੋਰਿਟੀ, ਸਮ ਕੁਐਸਚਨਸ ਇਜ਼ ਰਿਲੇਟਡ ਟੂ ਕੰਟੈਂਟ ਨੌਲੇਜ। ਸੋ ਤੁਸੀਂ ਇਹਨਾਂ ਕੁਐਸਚਨਸ ਦੇ ਆਨਸਰ ਦੇਣੇ ਆ ਐਂਡ ਫਿਰ ਬਾਅਦ ਜਿਹੜਾ ਕਮੈਂਟ ਕਰਨੇ ਆ ਇਸ ਵੀਡੀਓ ਦੇ ਨੀਚੇ ਕਿ ਤੁਹਾਡੇ 20 ਚੋਂ ਕਿੰਨੇ ਨੰਬਰ ਆਏ। ਐਂਡ ਜੇ ਤੁਸੀਂ ਐਕਸਪਲੇਨੇਸ਼ਨ ਚਾਹੁੰਦੇ ਹੋ ਕਿਸੇ ਪਾਰਟਿਕੂਲਰ ਕੁਐਸਚਨ ਦੀ, ਜਿਹੜੀ ਕੁਐਸਚਨ ਤੁਸੀਂ ਲੱਗਦੇ ਕਿ ਤੁਹਾਨੂੰ ਸਮਝ ਨਹੀਂ ਲੱਗੀ, ਤਾਂ ਤੁਸੀਂ ਜਿਹੜੇ ਆ ਸਾਨੂੰ ਕਮੈਂਟ ਡਾਊਨ ਕਰਨਾ ਆ। ਆਪਾਂ ਇਸ ਦੇ ਰਿਲੇਟਡ ਜਿਹੜੇ ਆ ਵੀਡੀਓਜ਼ ਨੈਕਸਟ ਲੈ ਕੇ ਆਵਾਂਗੇ। ਸੋ ਹੁਣ ਕਰਦੇ ਜੀ ਆਪਾਂ ਟੈਸਟ ਸਟਾਰਟ। ਸੋ ਟੈਸਟ ਦੇਣਾ ਆ ਬਿਨਾਂ ਕਿਸੇ ਚੀਟਿੰਗ ਤੋਂ। ਲੈਟਸ ਸਟਾਰਟ। ਐਂਡ ਵਨ ਮੋਰ ਥਿੰਗ, ਜੇ ਤੁਹਾਨੂੰ ਮੇਰੀ ਇਹ ਵੀਡੀਓ ਵਧੀਆ ਲੱਗੂਗੀ ਨਾ ਤੁਸੀਂ ਮੈਨੂੰ ਕਮੈਂਟ ਕਰਨਾ ਆ ਐਂਡ ਮੈਂ ਇਸ ਤਰ੍ਹਾਂ ਦੀਆਂ ਹੋਰ ਕੁਐਸਚਨਸ, ਇਸ ਤਰ੍ਹਾਂ ਦੀਆਂ ਹੋਰ ਵੀਡੀਓਜ਼ ਜਿਹੜੀਆਂ ਤੁਹਾਡੇ ਲਈ ਲੈ ਕੇ ਆਉਂਦੀ ਹਾਂ।
Question 1. Which of the following drugs is most associated with an increased likelihood of twin pregnancy? A. Letrozole. B. Clomiphene. C. Metformin. D. Bromocriptine. Question 2. Which assessment finding confirmed the asthma diagnosis? Inpatient. A. Cyanosis around lips and mouth. B. Inspiration and expiration wheezing. C. Normal respiration rate. D. Increased forced expiratory wheezing. Question 3. Which of the following is the drug of choice for management of hypertension in pregnancy? A. Enalapril. B. Labetalol. C. Atenolol. D. Losartan. Question 4. A 32-year-old male with third-degree burn on trunk, neck, and face. Which nursing diagnosis takes priority? A. Disturbed body image, related to physical appearance. B. Impaired urinary elimination, related to fluid loss. C. Risk of infection, related to third-degree burn. D. Impaired airway clearance related to edema. Question 5. A 62-year-old patient with type 2 diabetes is taking metformin and is scheduled for a contrast-enhanced CT scan. His baseline RFT, renal function test, is normal. Which of the following is the best action? A. Continue metformin because renal function is normal. B. Withhold metformin only if symptoms of lactic acidosis develop. C. Temporarily discontinue metformin. D. Reduce the dose of metformin on the day of the procedure and continue thereafter. Question 6. A nurse enters in patient room with myocardial infarction and see the patient who is on floor, collapsed and unconscious. Nurse checks there is no pulse. What should nurse do next? A. Assess airway and breathing pattern. B. Recheck the pulse for 10 seconds. C. Start chest compression. D. Give oxygen through Venturi mask. Question 7. A patient admitted with suspected acute appendicitis initially reports severe right lower quadrant pain, 8/10. A few hours later, the patient states the pain has suddenly decreased to 2/10 and appears more comfortable. Which of the following is the priority nursing interpretation? A. The inflammatory process is resolving spontaneously. B. The patient is responding well to analgesic therapy. C. The appendix may have perforated, requiring urgent evaluation. D. The pain assessment was likely inaccurate initially. Question 8. A nurse deal with old age patient who have diarrhea and positive with Clostridium difficile, C. diff. What is the best method for infection prevention? A. Wear proper personal protective equipment. B. Use alcohol-based hand sanitizer after leaving the patient room. C. Wash your hands with soap and water. D. Wear mask and gloves before entering in patient room. Question 9. Which of the following findings in a patient with depression should alert the nurse to the highest immediate risk for suicide? A. The patient remains withdrawn, avoids eye contact, and refuses meals. B. The patient reports feeling a little better and has started interacting with others after days of isolation. C. The patient expresses hopelessness and states, "Nothing will ever improve." D. The patient denies suicidal thoughts and requests discharge. Question 10. A 40-year-old male patient appears tearful, comes to hospital with suspected stroke. What will be the nurse priority action? A. Give intravenous ringer lactate solution to patient. B. Send patient for CT scan. C. Give thrombolytics, like Ataplace. D. Provide emotional support to
11.
patient. A client rescued from a house fire has SPO2 100% on room air, mild headache, and carboxyhemoglobin level 18%. What is the priority action? A. Continue monitoring SPO2. B. Administer 100% oxygen via non-rebreather. C. Encourage deep breathing. D. Start for fluids. Question 12. A patient with chronic obstructive pulmonary disease has SPO2 88% on room air and is alert. What is the best action? A. Withhold oxygen. B. Give high-flow oxygen. C. Give low-flow oxygen, 1-2 liters per minute. D. Intubate immediately. Question 13. A patient with alcohol withdrawal syndrome becomes restless, diaphoretic, and reports seeing insects on the wall. What is the priority action? A. Reorient the patient. B. Administer benzodiazepine. C. Reduce environmental stimuli. D. Offer fluids. Question 14. Who is priority? A. Hyperkalemia. K. Mice. 7. ECG. Changes. B. Patient with RR10, min after opioids. C. Patient with DKA glucose 500. D. Patient with NA mice 125. Question 15. A nurse tapes all 4 sides of a chest wound. Patient suddenly worsens with dyspnea, hypotension, absent breath sounds. What happened? A. Infection. B. Fluid overload. C. Tension pneumothorax. D. Pulmonary edema. Question 16. A patient on clindamycin develops severe watery diarrhea with foul smell. What is the priority concern? A. Electrolyte imbalance. B. Drug intolerance. C. Clostridioides difficile infection. D. Allergic reaction. Question 17. A 8-year-old female is receiving rifampicin for tuberculosis. She reports that her urine has turned orange and also states she recently missed her menstrual period. She says, "I have been taking my birth control pills regularly." What is the nurse's best response? A. The orange urine indicates kidney damage. Stop the drug immediately. B. Rifampicin reduces the effectiveness of oral contraceptives. C. This is a normal hormonal fluctuation unrelated to the medication. D. You should double the dose of your contraceptive pills. Question 18. A client using an intrauterine device, IUD, reports symptoms. Which symptom requires priority assessment? A. Mild cramping. B. Irregular spotting. C. Fever and foul-smelling discharge. D. Heavier periods. Question 19. Which are the sign and symptom of left-side heart failure? A. Pitting edema in lower extremities. B. Difficulty in breathing. Dyspnea when lying flat. C. Rapid weight gain. D. Persistent fatigue. Question 20. A postoperative patient after hysterectomy shows which sign that requires immediate nursing intervention? A. pain level 6/10. B. Urine output 40 ml-. C. Saturated abdominal dressing with bright red color blood. D. Mild nausea.